I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast.
So sorry, before we start, do you mind, I did a very brief intro, but do you mind giving a quick elevator pitch in terms of who you are and the work that you do?
Sure. So my name is Dr. Sadaf Lodhi, and I am an OBGYN. I'm board certified here in the U.S. I've been a gynecologist, an OB now after my training for 18 years. And so currently I'm still practicing OBGYN and delivering babies and all of that stuff. So, yep, still practicing. And I'm also a sex coach that I recently started, and I'll be continuing my education in sexual counseling and education through the University of Michigan. My sex coaching is a program through Rutgers University in New Jersey.
Lovely. Just the basics. What is, I don't know how to pronounce it properly, obstetrics? OB part of OB-GYN. Yeah, can you explain what that is and what the difference is between OB and GYN, please, especially for the male viewer?
Yeah, absolutely. So obstetrics is the branch of medicine and surgery that deals specifically with childbearing. So it's pregnancy, it's delivery, and then the postpartum period and all the diseases and things that can happen during that time frame for a woman. And then gynecology is literally means the science or study of women, and it deals with mostly the health and diseases of the reproductive tract. So the uterus, the fallopian tubes, the ovaries, the female genital area, that. So that's the difference. So one deals with childbirth and the other one is just the gynecology, just the regular stuff like STDs, female health, well visits.
Are they two separate, and are they two separate like qualifications, two career paths?
No, actually, so it's combined. So here in the U.S., we do a 4-year residency. So, for example, a person will get an undergraduate degree through a university, and then they'll apply to medical school, and then they'll go to medical school for 4 years, and then we'll apply for residency, and that residency also is 4 years. So, and in that training, we learn surgery, we learn the medicine of both obstetrics and gynecology. And so we get to practice both.
Right.
And that's actually what was so appealing to me about the specialty is that I was very interested in surgery as a medical student, but I wanted something that combined both medicine and surgery. And that's why OB is so fantastic, because not only does it focus on women's health, but you also get to perform surgery. So you get to be in the operating room as well.
Lovely. You kind of answered my question, but the next question I was going to ask is what inspired you to get into or to become an OBGYN?
Yeah, so, when I was in medical school, I really enjoyed hormones. And I actually thought that I wanted to do endocrinology. My undergraduate degree was actually in biochemistry. So I really enjoyed hormones and learning about chemicals and biology and how they came together. And then when I went to medical school, I again was fascinated by hormones, and I thought I wanted to be an endocrinologist. So I did some rotations in that, but I found that to be rather boring because it just focused on diabetes, and that was not something that I was really interested in. So then as I went through my medical education and did rotations as a 3rd and 4th year, I got a chance to do a rotation in OBGYN and fell in love with it. But to be honest, the first time I saw a normal delivery, I almost passed out. I was like, oh my God, there's so many fluids and things like that and blood all over the place. So I wasn't that excited. And even a C-section, I was like, oh, I don't know if I can do this. But then, as the time went on and I did more deliveries and my rotations continued, I decided that that's where I wanted to be. And I also wanted to focus on women's health, which to me, I felt like in our communities, at least in the community that I grew up in, I felt like women's health wasn't really focused on. And I wanted to learn more about it for myself, but also to empower other women. And I thought it was really important.
I'm sorry, which community are you referring to? Just again for the benefit.
So it's just so the Muslim community that I grew up in, women kind of always took like, were always in the shadows and didn't really speak up as much. And I had grown up in a very conservative environment. And so I didn't have too many female role models. We had a few, but not too many growing up. My mom was probably my biggest role model because she stayed at home, but she was always there when we needed her and, took care of us and everything at home. But I thought it was important for other women and girls to see women empowered and also knowledgeable and to be able to be advocates for other women. So I thought that was really important.
Indeed. And now you've embarked on a career as a sex educator and sex counselor. Do you mind sharing a little bit in terms of what got you into that? Because I imagine it's quite different to being an OB/GYN, or is it similar?
Yeah, no. So actually, personally, I feel like what better person than somebody that is an OB/GYN to talk about sex, right? I mean, our focus, especially in gynecology, is on the female reproductive organs. And we have very intimate knowledge about the organs and the systems of the female reproductive tract. So, and especially in terms of like the diseases, but not only that, but some of the conditions such as vaginismus that occurs in women that have issues with intimacy. I think that gynecologists are very well versed in dealing with sex and sexual counseling and coaching. And of course, urologists are also very good in terms of dealing with sexual issues and intimacy as it arises with patients and specifically female patients. And I feel like, female patients are very shy and modest, and regardless of whatever culture you come from, I feel like it's still a very big taboo, and it's not really openly discussed, and definitely female pleasure is not discussed. And so that's why I truly appreciate your books and all of your books that focus on female pleasure, because that's something that is often neglected.
So you mentioned vaginismus. Do you mind defining what that is and whether, is it something that you commonly come across with your female patients?
Yeah, so often patients will come in and they'll say that they're, having a hard time having sexual intercourse and with intimacy. And what happens with vaginismus is that the woman tenses up right before intercourse, so that intercourse becomes very painful for her to have. And some of the treatments for that, mostly a lot of it has to do with the emotional state of the woman, right? And whether or not she feels comfortable and whether or not she's experienced abuse in the past, that's a common thing that a lot of women don't discuss and needs to be addressed. But the fact that they tense up, if it's mostly something that they experience psychologically, then it's very important for them to see a therapist and to heal first from the emotional trauma that they may have experienced in the past or the abuse that they may have experienced in the past. And that, a lot of times, that is what causes the vaginismus. Sometimes it can be anatomical, and, for that, what we do if there is, say, like there is a shortened vagina due to pelvic surgery or chemo or radiation or something like that, we can prescribe dilators for women to increase their length and also prescribe some lubrication so that sex is not painful. But vaginismus in itself is the tendency for the vagina to tighten up right before intercourse.
Yeah. And again, can you tell us a little bit about because I know you got your TikTok page and how you're finding it in terms of giving out sex education, especially on a different medium now with TikTok. How you find it?
Yeah. So what happened is that in November, this past November, I decided I wanted to do sex education and sex coaching. I thought, what better way to do it than to go on social media? So I opened up an Instagram account and TikTok account. And I got lucky with one of my TikToks that actually went viral. It almost has 1 million views now. And the title of that one was Muslim Mom Talking About Sex. So that got a lot of views and a lot of clicks. And I think because a lot of people, think of it as an oxymoron, right? A Muslim woman talking about sex. And it's not something that most people consider or even think that should happen. In fact, a lot of the comments that I get on TikTok will be from people that, there's a lot of good comments, but there's some men in there that, or it can also be women, that have a lot to say and believe that, women shouldn't be talking so openly about intimacy, or that they should be covered, or that it should only be amongst women. And some of them have suggested that, perhaps, I'm talking about my own experiences, which is not the case, So it's been quite a journey. I think that it's interesting and I'm learning, but it's something that I believe in. And I believe that, education is very important. That's actually one of my core values. And to be able to teach sexual education and to talk about it openly, so that women feel more comfortable, is very important to me. And so that's why I started the TikTok and the Instagram, and because of its far reach. People actually, that one particular TikTok, most of the views were in Pakistan, and then the United States and United Kingdom, and even in Saudi Arabia and UAE. So, that seems to resonate with a lot of people. And I know that you've had sex educators on your platform before that were also Muslim. One of the biggest complaints that I seem to get on my TikTok is that people are always asking me about hijab. Where is my hijab? So that, people will find out, will actually, be surprised to learn that I actually wore hijab. I wore hijab for 8 years when I was in undergrad, and then in undergrad, in medical school, and then actually my first year of residency. But while in residency, it became difficult to wear the hijab because it would go into unclean areas while I was doing deliveries and such. So it became a little bit more difficult to wear the hijab. But now there's definitely lots of ways to wear hijab. And I feel that, it's a choice that women make, and, it's something that they have to feel comfortable with. So
what's the correlation between you wearing a hijab and you talking about sex? Why do those questions come up?
I don't know. I think that, men tend to feel very uncomfortable. They feel threatened. And I think it has to do a lot with, how they feel modesty is and how women should be. I mean, I don't know, maybe you could help to explain, a little bit what the, why people find it to be such an oxymoron of why a woman can talk about sex, but it's only good if she wears hijab, and if she doesn't wear hijab, then she shouldn't be talking about intimacy. I'm not really quite sure that I understand the correlation.
Yeah, that's interesting. I was just thinking of the title while she was talking. I was writing, because obviously you mentioned the title Muslim mom talking about sex. I tried to use the American pronunciation because we spell mum with a U instead of an O. But then I was thinking, if it was entitled, I was wondering, would people be more outraged or less outraged, if it was a Muslim gynecologist, because obviously you're a professional, or is it because it's like the mother, like a Muslim mum, was like a combination of the two? If it was a Muslim woman talking about sex without a reason, I'm just wondering, like, why. And it's good that it went viral, but I'm just wondering what people reacted so. Yeah.
That's a good question. I don't know. Although, on my page, it does say I'm an OBGYN. And so, a lot of the supporters that I get, will always say, well, she's a gynecologist. She's, a doctor. What difference does it make? She's trying to educate, So I think that perhaps that could be part of it too, is that, it said mom and not a gynecologist. But if you just go there and take a look at the handle, it says everything. So I don't know. I find it fascinating. It's really interesting, right? What people say and how many opinions everyone has about, how others should live and and what they should talk about and what they shouldn't. So it's interesting.
And I'm just wondering, what has been the response when you've spoken about, because I know you recently put up a post about the orgasm gap. You've spoken obviously about women's pleasure. other comments, and I don't like to concentrate on negatives. I'm just wondering in terms of, like, are people more, like, because if you're speaking about sexual health and again, you're a professional, that's your field, some people may be, okay, we understand that, but I'm wondering, are people more resistant if you're speaking about, like, the female orgasm or women's pleasure or...
Yeah, I mean, you know, sure. No, that still gets a lot of views. You know, actually what happens with that one is that women actually are commenting on it, not so much about hijab or anything like that, but they're just talking about, you know, they're asking questions like, why is it painful? Or, you know, I never achieve orgasm, or how can I achieve orgasm, and things like that. So that is a big topic that resonates with a lot of women, regardless of what your cultural background is, you know. And I think you speak a little bit about that, actually quite a lot about that in your books, and how you emphasize the female pleasure and how important it is in a relationship, in a healthy relationship. And I think that those are all very important aspects. And you mentioned also communication, which is a vital part of, you know, decreasing that orgasm gap, which I think that people, you know, tend to not think about, and something that is very easy that we could do to help alleviate some of that and to get rid of that gap.
No, entirely. Someone actually asked a question about the hymen. I just wanted to ask before we move on, but do you mind, like, does a smear test reduce or break, sorry, will getting a pap smear break my hymen?
Oh, so that's a great question, and the answer is no. No. So the pap smear is actually, you know, is this screening tool that it's called a Papa Nicolau, and the pap smear is actually screening. What we do is screening for cervical cancer. And, you know, it's recommended here in the United States that women after the age of 21 get a pap smear. And what it's specifically testing for is the human papillomavirus. And that virus is known to cause cervical cancer. And it's also known to cause genital warts. And there are different strains of the virus. And that pap smear will actually screen for the specific strains of the virus that can cause abnormal pap smears and may result in cervical cancer. But they have to understand that not all, just because a patient has or a woman has HPV, which is human papillomavirus, it does not mean that it will lead to cervical cancer, and that's very important to understand. Having the human papillomavirus, especially for a woman in her 20s, a lot of times it goes away on its own. And that's why we decrease the frequency of how often we test for the human papillomavirus and how often we require a woman go for her pap smear. So, right. And, you know, it's important. And while we're on this topic, you know, I should also add that it's very important to get the vaccine, the Gardasil vaccine, or the vaccine specifically for the human papillomavirus, because that vaccine has been proven to show that, you know, kids, so now the age for getting that vaccine is age 9 through up until the age of 25. That people can get that vaccine. And it has been shown to reduce the incidence of HPV. And it's recommended for both boys and girls, because even though, you know, boys will not get cervical cancer, they may be exposed to genital warts. And so that vaccine will prevent that. And what's important to note is that, you know, sometimes in the Muslim community, we think that our daughters or our sons, you know, will not engage in premarital, you know, intercourse, which we hope that that's the case, but it may not be. And so I recommend to all parents for them to get their children vaccinated against HPV. I think it's so important, and it's something that they can do for their children's future.
Thank you. Again, just for the benefit of people joining, I'm speaking to Dr. Sadaf Lodhi, who is a board-certified OBGYN based in the United States. She's also a sex educator, a sex counselor. She has a podcast. She's a co-host of a podcast called the Muslim Sex Podcast. And you also can check her on TikTok, and she's got a following of over 21,000 followers. And a couple of, I don't know, they don't call them reels, isn't it? Because it's TikTok. What do you call the videos in TikTok?
Reels, I think. Do we call them Reels?
I thought Reels was specific to Instagram. But anyway, a couple of her videos have gone viral. So you can go and check it out. And check out her podcast, which I want to touch on a little bit later. But before we get on to your podcast, actually, I did have a couple more questions. Yeah, what are some of the common concerns that you find that women, from your experience, face in relation to sexual satisfaction?
Right. So, a lot of times women will complain that they're not able to achieve orgasm, right? That's actually probably the biggest complaint. And some women say that they, even in their 30s and 40s, are not able to experience orgasm, right? And some women feel that they'll never achieve it. And so they don't really enjoy intercourse. They don't initiate it. It's not something that they desire. So that's one of the biggest things that I hear. Also, there are women that complain of monotony and painful intercourse, not enough lubrication. There's some women that feel embarrassed to use lubrication, and their partners think that they're just not aroused. But, and I think that's important to understand as well, is that lubrication does not mean that a woman is aroused or not aroused. No, if you have lack thereof of lubrication, doesn't mean that she's not interested in her spouse, right? So there's nothing to be ashamed of. And, there's lots of lubrication out there that can be used. Some people even use coconut oil for lubrication, which is fine. The only thing that you have to understand with coconut oil is that sometimes it can affect the integrity of a condom. And so, it will affect, like, for example, the latex condom, it can affect the integrity of that. And so what you want to do is be careful when you use the coconut oil. So condoms are good for, protecting against a woman becoming pregnant and sexually transmitted diseases. But if you use things that are not safe, lubricants that are not safe to be used with condoms, a person can still get a sexually transmitted infection, because the pores, the bacteria can go through the pores that affect the integrity of that condom. So that's important to know what type of lubricant that you use and what type of condom that you're using. And in fact, the natural condoms, the lambskin condoms, the pores are really big. So it does protect against pregnancy. However, it will not protect very well against sexually transmitted infections. So that's important to know, just for contraception's sake. Some women also, they complain of lack of foreplay, or, a lot of women have body image issues as we get older, after we have children, and so that makes them feel less, sexy in the bedroom. And so they don't desire intercourse as much. So those are some of the common complaints. So with sex coaching, what we try to do is try to go through the beliefs that women have, whether, if they're learned beliefs, or if those are beliefs that they've held for a long time, go through their cultural baggage that they may have in terms of how they feel about intercourse, and try to dismantle them and help women to recognize what they're feeling, their emotions, their thoughts, and try to work through them so that they have a more pleasurable experience during intercourse.
And the sex coaching that you provide, is that only face-to-face, or do you provide some coaching online?
Yeah, actually, no. There's, with the pandemic, and it's just much easier to do everything online. So currently everything is online. There's no face-to-face. And it's important to note that I only work with women. I don't work with men. Because I'm a gynecologist, I feel I'm well-versed to speak mostly with women, and that's kind of my interest, is Muslim and, female sexual pleasure. That's really my focus, and how women can explore and experience and enjoy their own sexual pleasure.
And is all the information about your coaching and your work, is that all on your website? I'm just, again, for people who want to find out more.
Yep, absolutely. So it's on drsadaf.com, and it's actually, the website is going to go live this weekend. So they can definitely go online and take a look and see if that's something that applies to them, and if that's something that they're interested in. I feel like all of us could use a little bit of coaching. And not only do I deal with sex coaching, but also life coaching and, executive coaching as well. But my focus mainly is sex coaching for Muslim women.
So you said executive coaching?
Executive coaching as well, yes, because the program, my program that I've done or I'm completing is through Rutgers University, and that is actually leadership coaching and organizational performance. So basically those that are looking, that have careers and that are looking to get promoted, or, you know, issues in the office and things like that, and how to deal with them. So that's what the executive coaching is. And it deals also with like institutions and organizations, and working with professionals and leaders in those organizations, like the C-suite, you know, CEOs and things like that. And then life coaching can be for anyone, right? If they feel stuck in a certain situation or certain beliefs, it's to help overcome that. And sexual coaching obviously deals specifically with intimacy in and out of the bedroom. Right. So different types. Yeah, absolutely.
Got another question that I want to ask. That someone posed me on my Instagram story. Why does sex hurt?
Why does sex hurt?
Assuming there's a woman that asks.
Yes, of course. It's so, you know, there can be several reasons why a woman may experience pain during intercourse. You know, some of them we talked about a little bit. Pain with intercourse can be divided into three different sections. It can be entry pain, it can be pain with deep penetration, or it can be emotional factors. And all of those three things can cause pain with intercourse. So when we talk about entry pain, we're just specifically talking about lubrication. There's definitely after childbirth, sometimes it's difficult for a woman to have adequate lubrication so that intercourse doesn't hurt. In fact, women that have had vaginal deliveries, and even those that have had C-sections, will notice pain with intercourse because, you know, as some people may know, that the more you have intercourse, the more elastic your vagina is, and the easier it is to have intercourse. So and then the less intercourse you have, the tighter the vagina becomes, and it can become very, it shrinks. So basically you either use it or you lose it, is kind of what we say. So if you're not having intercourse, then that vagina becomes tighter and it becomes more painful to have intercourse. And that's true for a lot of women, especially during pregnancy, because during pregnancy, they may feel uncomfortable to have intercourse. They may not like it. They may think it's strange, whatever their beliefs are regarding intercourse during pregnancy. They may not have, intercourse for a long time. And then given delivery and then waiting 6 weeks after delivery, you could be talking about going months without having intercourse, right? So then the first time that they have intercourse after a pregnancy and a delivery, it will be very painful. And without lubrication, it can be even, difficult. And some women decide they don't even want to have intercourse, So I tell them to take it stepwise, do a lot of foreplay, and that will increase the lubrication, and to use lubricants, right? Because that's what they're there for, to make intercourse easier and more pleasurable the first time they decide to have intercourse after childbirth. So childbirth is one of the main causes of painful intercourse, after having children. Also, if you're nursing, when you're nursing, you have decreased estrogen and progesterone. Those hormones fall off when you're nursing. And so because of that, and estrogen, as we know, is responsible mostly for the lubrication that happens in a woman, she may not be lubricated enough while she's nursing. And so because of that, she may have pain with intercourse. So that's another reason that women experience pain with intercourse. Also, hormonal contraception. For example, hormones that have progesterone only, like you have the IUDs that have progesterone only, you have implants that are progesterone only, you have the Depo-Shot, which is progesterone only. So sometimes those oral contraceptives that are progesterone only can cause a woman to be, not be lubricated as much during intimacy. And so a woman may need to use, again, lubricants when she has intercourse. So those are some of the most important things. Of course, you also have, in the vagina, a woman can have an infection. For example, if she has a sexually transmitted infection, or if she has a yeast infection, any type of infection within the vagina can cause irritation and cause painful intercourse. You can have inflammation in the vagina. You can have some type of congenital abnormality. What that means is that maybe the vagina isn't formed properly, or maybe there's two vaginas, or, so there's different types of abnormalities that can happen, or, a woman can be born with. So that's why it's so important to have a working relationship with your gynecologist, so that if you're having issues such as that happen with entry pain, right, that you go and you see your gynecologist so that they can evaluate and see what's going on with the vagina and see if there's any type of infection or inflammation or whatever else. Maybe there's a tear. Maybe there's, something that happened during childbirth that wasn't repaired properly, whatever. So that's important. So that's one of the first things that I would think about is entry type pain. The second is pain with deep penetration. And that can happen when, say, for example, say a woman has had some type of pelvic radiation, say if she's had cervical cancer or some type of cancer in the female, genital tract, and she's needed chemo or radiation, and that can cause scarring in the vagina, right, and in the pelvic area, and that can cause pain with deep penetration. Also, if a woman has something like endometriosis, which again can cause scarring in the pelvis, that can cause pain with deep penetration. Or you can have fibroid, like a fibroid uterus, which can be, and I'm sure your viewers are aware of what fibroids are, but fibroids are benign growths that can happen within the uterus, and they can make the uterus very large. And so if you have a big, bulky uterus that is right at, let's say at the tip of where, with deep penetration, that can make intercourse very uncomfortable. So it's important to be evaluated. If you continuously have pain with intercourse, it's important to know whether it's entry pain, whether it's pain with deep penetration. And of course, we have the psychosocial aspect as well, right? The emotional aspect of it. And that can be due to, stress, anxiety, depression, and also sexual trauma, right? Some women have experienced sexual abuse. And so all of those things are very important to address. And if you continuously have pain, it's important to seek out help, whether it's with a therapist or with your gynecologist.
Thank you. Thanks for that. And how often would you encourage women to go and see their gynecologist?
I'm sorry, say that again?
So how often would you recommend women to go and visit their gynecologist?
Yes, definitely. So I would recommend them to go at least once a year. Once a year, even if you don't require a pap smear, I think it's very important to go and get, a full body exam, get your breast examined. It's important to do a self-breast exam yearly. It's also important to get a pelvic exam at least once a year, and just for a complete checkup and to make sure that, everything looks normal. And if you're having any issues, it's important to discuss it with your gynecologist. So at least once a year. And, if you have problems, then to see them more frequently.
Lovely. And someone asked a question. What causes numbness or loss of sensation?
What causes what?
What causes numbness or loss of sensation?
Right. So, numbness has to do with the nerves, right? So if they're talking about numbness in the vaginal area, it could be due to trauma. That's typically the number one reason. Trauma from childbirth, trauma from perhaps sexual abuse. It could also be from chemo or radiation. Anything that affects the nerves in the pelvic region will cause numbness.
Thank you. Okay, just for the benefit of people joining, I'm speaking to Dr. Sadaf Lodhi, who is a OBGYN, a sex educator, a sex counselor, and a sex coach. She has a new website which is launching this week, and she is the co-host of the Muslim Sex podcast. dropping a lot of information today. A lot of information. Gonna have to listen to this again. But again, yeah, like I said, I'm speaking to Dr. Sadaf Lodhi, and now I kind of want to get into your podcast. So, the Muslim Sex Podcast. I mean, I imagine it's about what it clearly says in the name, but do you mind talking to us a little bit about it and what inspired you to set up this podcast?
Absolutely. So the podcast was, so my co-host and I, Zabeen Mirza, she and I were talking one day, and we were talking just about different sexual health matters. And we thought, wouldn't it be a great idea if somebody had a podcast where they discussed female issues openly? And, so she and I decided that was one, that it was a great idea, but two, because I am a gynecologist, I felt that I would be a great person to talk about female issues of the reproductive tract, of childbirth, of sex and intimacy. And so that's kind of where the inspiration from that came about. And also because Muslim women, at least in my growing up and my encounters, it's a topic that we don't really discuss, and it's definitely a need that's there, and it's a niche that is definitely void of a lot of information. And so I felt that it was very important to go out there and to talk about science and evidence-based medicine, and help to relay information to women that may be too shy to go and approach others and to even discuss it amongst their own physicians. Right. And so that's something actually that we notice even in the exam room. When women come to see the gynecologist, that's usually not their first question that they ask. They'll come in for their annual exam, and they'll talk about, like what's going on with their periods and things like that. But sex is not something that women openly discuss. And it's only if a gynecologist, specifically asks about their sex life will they divulge that information. So it's important. And even in that private, atmosphere, private encounter with their own physician, women are not that forthright to discuss those topics. So that's why it was important for us to discuss it. So that's why we started. And the things that we talk about, the first episode discussed anatomy of the female anatomy. The second episode was about sex and intimacy. And then we went from there. We talked about fertility, infertility. We spoke about sexually transmitted infections. We spoke about contraception. And currently, this week's episode is talking about childbirth and C-sections and, epidurals and things like that. We also discuss pregnancy and what happens, in the first, second, third trimester and postpartum. So topics such as those. And that's why it was important for me to be able to discuss that and share that with listeners and people that were interested, and those that, may not be able to discuss it, but wish to, listen to it privately on their own.
And where can people find the podcast?
Yeah, so you can find that podcast. I actually have a YouTube channel, but you can also find it on Apple Podcasts and Spotify. So, anywhere where people get their podcasts, they can find it and listen to it if they want. And we also post like little trailers and snippets on TikTok and Instagram, so people can kind of get a feel for what the topic is about and take a listen.
Lovely. And where do you see the podcast like 5 years from now?
The podcast, I feel like it's going to continue. I feel like there's so many topics that we haven't even touched. And I feel like there's just so many things that come up, research, talking to other podcasters. There's so many women with so much knowledge that I feel like it's very important to be able to relay that information and knowledge to others and women that are seeking it. So I think it'll continue, inshallah.
And do you plan to attract male, men? Are you plan to attract male audiences to your podcast?
Well, yes, absolutely. I mean, definitely. If, for example, if you wanted to come on, I'd be more than happy to have definitely you come on and speak about all the books that you talk about. And there's so much information there. And, I think it's so important to realize what Islam says about a woman's rights to sexual satisfaction and what her rights are that she has over her husband. And that's something that, we don't focus on. And even in society, even in American society, I think Western culture, female pleasure and her pleasure is definitely not a priority. It's starting to become one now. But, even if you think about it, for sexual dysfunction, what were some of the first medications that we had, right? It was for erectile dysfunction. We had Viagra, we had Cialis, right? Women's pleasure was never really at the forefront. And when you think about why that is, it's because most of the research that is done on medications is done on white men. And so, women's pleasure, women's issues are not something that are often, funded. And so that's why it's important to be able to discuss these issues and bring them to the forefront and bring that research and scientific knowledge that we're gaining about female sexual pleasure and increase funding to it so that we can have more information.
And part of the training of a gynecologist, does it include like women's sexual satisfaction and female pleasure? Is that something that's part of the training?
Yeah, so actually I'm glad you asked because no, not at all. We spent 4 years learning about, and there's so much information, right, about childbirth and what happens in pregnancy and all of those things. And then we spend a lot of time on ultrasound. We spend time on reproductive endocrinology and infertility. We spend time on urogynecology. We spend time on high-risk medicine and high-risk pregnancies. But, and minimally invasive disease, minimally invasive surgery, specifically laparoscopy and robotics and all this stuff, right? Because OBGYN is a combination of both obstetrics and gynecology. But definitely, female sexuality is not at all a focus. None. We receive no, at least definitely in my training, there was no training, no education on it at all. So it's something that you have to seek out yourself if you're interested in it, And so that's why I'm sure you're probably surprised from that because there's no training on it.
Yeah, I heard that, but I wanted to hear that from a gynecologist myself because I heard that from a urologist and she also mentioned that like female sexual pleasure is rarely discussed in her training. She also mentioned the gynecologist as well, and she even mentioned like the clitoris as well. It's not really mentioned in terms of it being for pleasure. And I was trying to understand, why do you think that is?
I think the reason why that is the lack of research, right? The lack of research, the lack of scientific papers on it. I just think that it's, women's pleasure was never a priority, even, and I think, you had asked me just prior to this about a question about whether or not in medical school, are we taught anything in medical school regarding female pleasure? And actually we're not. The only thing we learn is the study that was done by Masters and Johnson, which I'm sure you are very familiar with, right? That 1966 research that talks about the 4-stage linear model of sexual response. And all they talk about is excitement, plateau, orgasm, and resolution, right? And again, that study is biased and it's based on the male sexual response. It doesn't take into account women at all. Even though they had 10,000 respondents for that study, it was not, women were not included in that study. So, I just think that there's such a lack of knowledge on this topic. And so, we're not taught it at all. And what we're taught is not even that relevant anymore. It doesn't even pertain to women's sexual pleasure, right? So that's right. So that's what we learned. And, a lot of times in that theory, it assumes that sexual intercourse is spontaneous, right? That it's automatic, it's unprompted. And, that doesn't really always fit with women's experience. women a lot of times need to be prompted. And, you know, oftentimes for women, arousal comes before desire. And so it's what we learn doesn't even apply to the female experience.
And are things starting to change with in your field, like gynecologists? Are they, unless they're like yourself, actively seeking out this information research themselves? But I'm talking about with the big wigs, shall we say? Are they not trying to enlighten themselves what's going on?
Right, absolutely. So definitely, you know, it's starting to change. There is more research that's occurring. There's the American Academy of Sexual Education and Training, I'm trying to remember, but the acronym is AASECT. There's also an organization called ISHWISH, which is also the Institute for the Study of Sexual Wellness. So there are now groups and institutions, large institutions that are forming to discuss and to study female pleasure and making that a priority. But it was not something that was ever focused on before in, you know, the American College of OBGYNs, but now it is. And now, you know, they're training gynecologists to ask women about their sexual preferences and about their sexuality and also about, you know, pleasure and orgasm. And now this is a very recent phenomenon. But before this, I would say before, I don't know, maybe say the last 5 years, you know, before that, it wasn't something that we really focused on. Yeah.
That's that's astonishing. Are there any plans to do any like webinars or courses? This is actually my question. It's not someone else's.
I mean, I think that, you know, as I continue to grow and see more clients and patients, I'm going to see what their needs are. But definitely in the future, there is, you know, I'm looking at doing webinars and doing courses. And if, you know, people decide they don't want to do like a one-on-one coaching or like a group coaching, you know, they may benefit from a webinar on the website or, you know, a small little course study that they could do on their own during their own time. And that's definitely in the works for future plans for me. Absolutely.
Yeah, I definitely think there's, especially from qualified and professionals like yourself, there's definitely a need, not only within obviously the Muslim community, but the wider community at large. Someone asked me a question about, I think you kind of covered it, but I'll ask anyway. What is a hymen, and does the hymen break the first time a woman has sex?
Okay. So the hymen is a piece of tissue that is right at the opening of the vagina. And yes, it can break. It doesn't have to always break right at the time of first intercourse. Some women, you know, it can break even prior to that. But yes, I mean, for most women, it does break at the first time that they have intercourse. And some women can bleed from that, and other women don't. So, you know, it just depends. I don't think that there's a blanket statement that you can say that all women will bleed the first time that they have intercourse, right? And I think that's also a fallacy that, you know, some men may think that, say that their spouse or whoever was promiscuous or had intercourse prior because they didn't bleed when they had intercourse, you know, and I don't think that that's a proper way to think about, you know, whether or not just because she didn't bleed doesn't mean she wasn't a virgin prior to intercourse, right? So yes, so the hymen is a piece of tissue that's right at the opening of the vagina.
Okay, we've got a few more minutes. I want to kind of focus on men. Speaking about women, help the men out now. What advice would you give to men who want to help, you know, women understand pleasure and reach sexual satisfaction?
Right. So, you know, I think one of the most important things, I think, is that communication, right? I think that connecting with a woman at the intellectual level, I think, is very important, right? So, you know, respond to her with kindness, sweet words. You know, I think that massages are always good. I think that it's important for a man to, you know, understand what she wants, right? And I think it's important to have open communication, you know, see what a woman likes. And then, of course, you know, reciprocity, right? And for the woman to ask a man what he likes. I think that's really important. I think what most women desire, I think, is closeness and intimacy, emotional closeness, right? And I think that when women don't find that, then they become dissatisfied, not only in the bedroom, but outside of that. So I think establishing and promoting a form of emotional closeness with a woman, I think, is very important. Even before, going to the bedroom, I think it's important to talk and have that open communication and know the other person's needs and wants and see what they like and what they don't like, what their preferences are.
Very well said. Very well said. And in terms of like the female anatomy, there's a number of questions that people have asked, but especially in relation to men, what do men need to know about the female anatomy?
I think what men need to know and understand are the different erogenous zones that a woman has. And I think that your books go into that quite a bit. And I think that your books are actually a very good manual for that. But I think that's very important, right? It may not just be, say, like the breasts, right? It could be, the clitoris. It could be the lower back. It could be different things that a woman likes and what she enjoys and what she finds to be stimulating. I think those are important things to know. I think it's important for the man to understand the whole purpose of what the clitoris is, right? And it's the only organ in either of the bodies, right? Either the male or the female, that is solely for sexual pleasure. And I think that that's important to understand, right? They say that there's more than 8,000 nerve endings in the clitoris. I think it's important to understand, I think that somebody had asked a question about a vaginal orgasm, right? And trying to figure out how to attain that. And I think the important thing to know about that is where do you find what we call the G-spot, right? So the G-spot is found on the upper surface of the vagina. And some people actually think that that's where the roots of the clitoris crisscross. And as you mentioned, you call the clitoris the K spot. Is that what you call it? That K spot, right? Because you think, you believe it looks like a K, and I agree. I think it looks like a wishbone, and so, right, and so the fibers extend over into the labia, and I think it's very important for men to understand the female anatomy and to see what your spouse likes, enjoys, and what stimulates them, what arouses them, to find fulfillment in the bedroom. And I think that those things are very important. So what I was mentioning about the G-spot is anything that causes stimulation or pressure in that area, which is the upper portion of the vagina, can elicit a vaginal orgasm. And, that's really important too, if that's what somebody is seeking, right? And there's different types of orgasms. And again, I reference your book because I feel like your book is very good. And it talks about the different types of orgasms that are available to women. And men just have to do the research and do the learning. And women can be good teachers and educators themselves, right? They can teach their husbands or their partners, whatever, what excites them, what arouses them, and what causes them to have orgasms. And what's also important, I just want to say, is that, women are able to have multiple orgasms in the bedroom, right? It's not just one. They can have multiple. So that's important to understand as well. Some women report having as many as 20 orgasms in one session, which is amazing. But yeah, some women can. And so it's important for a man to understand the anatomy of a woman and see how he could please her.
Beautifully said. So the last question that just quickly popped up, I know we've got like 5 minutes or 3 minutes to go. Is it normal for your clitoris to have a loss of sensitivity or take a long time until you can orgasm?
Yeah, absolutely. Yes, I did. So absolutely. So, I think that there's no time frame, right? Like it's about constant stimulation and pressure and touch. There's no fixed time frame. There's no this has to happen within 5 seconds, right? So however long it takes a woman to orgasm, or however long it takes for her to become aroused or stimulated, and like we just spoke about, right, for a woman, arousal comes before desire. And so whatever and however long it takes a woman, that's fine. And it's, you know, it's specific to her body and what is right for her and what's stimulating for her. And I don't think that there really is a time frame. So it's okay, however long it takes, you know, and that's what your partner or spouse has to be accepting of and respective of, right? They need to respect that it takes you perhaps longer than what you think in your head it should take, right? There's no sex, there's no rules. There's no, you know, like this is the way it should be. And I think that's part of where coaching comes in, because we have our own set beliefs, our, you know, whatever we're taught or whatever we see, that's what we think should happen. And that's what our beliefs are, right? Our thoughts become our beliefs, which then become our actions. And once we change our thoughts, then we'll change our actions. And I think that will lead to greater pleasure, not only in bed, but also in our lives. And I think that's what's important to know.
Beautifully said. Beautifully said.
Yeah.
Okay. Thank you, Jazakallah Khairan, for sharing your words of wisdom, your knowledge. Before we wrap up, do you mind plugging, obviously, where people can find you, your podcast, and anything else you've got going that you want to kind of plug, please?
Yeah, absolutely. So I have, you can find me and you can DM me. So one request I have is that the DMs that come on my Instagram, please only women. I get DMs from men, and I appreciate it, but I specifically I'm specifically coaching women. So that's what I appreciate. And also you can find me on TikTok, and also you can go on drsadaf.com, and then it's the Muslim Sex Podcast, which of course you can find on Spotify or Apple Podcasts or the YouTube channel. So thank you so much. And thank you for having me on. And I can't wait to talk again. So thanks so much. I appreciate it.
Thank you very much. I'm going to make sure I save this, and obviously then I'll repost it. But thank you for speaking offline. Thank you everyone for joining.
Okay.
Good evening all.
Yeah.
Bye.
Bye.